You know, Vermont used to be a leader on important issues, and healthcare was one of them. Next year, we are going to have a change of administration in Washington. We are going to have an administration in Washington that is going to be more willing to allow states to be creative and look for ways to set up systems that actually work for all their citizens. We're going to have a congressional delegation in Washington that's open to that idea. I think we should have a governor who's able to work with those folks in Washington and able to work with folks here at the grassroots level to bring together the ideas and bring together the energy and make Vermont a leader in providing health insurance to all of our citizens, doing it in a way that lowers costs and keeps us healthier. Lowering the cost of health insurance is probably one of the best things we can do for our businesses and our families. It'll help us lower our school budgets and our town budgets. It will take healthcare off the negotiating table when you sit down with your boss to talk about your wages and benefits. We'll be able to focus on those things instead of arguing about the cost of health insurance. It should not be tied to the workplace. You should have good health care regardless of where or whether you work. And frankly, we should get businesses and employers out of the business of being healthcare providers. That's not what they want to do. If you're a construction company, you want to work construction. You don't want to be spending a lot of time and effort with your employees trying to make sure that they have the right health insurance coverage and then trying to find a way to come together to pay for it. What we need to do is to put every Vermonter into one large health insurance pool. I think we need a Vermont Health Insurance Plan. We come together the same way some large businesses have come together in the past to see to it that we can provide health insurance to everybody. Now, if everybody's in the plan, if everybody's paying into the plan, the costs get reduced. It's going to take some courage. It's going to take some coming together to think about the best way to do it. If we had a Vermont Health Insurance Plan that covered all of us, we could have it be administered by one entity. That's where the bills would go. That's where the payments would come from. We wouldn't be arguing with insurance companies. We wouldn't have private insurance companies telling you when to leave the hospital. We would cut administrative costs dramatically. Everybody knows that about 30 cents of every dollar we spend on healthcare now goes to paper pushing, goes to administrative costs. Your healthcare provider is spending as much time chasing down dollars as they are spending time with patients. And you open up the envelope at the end of the month and you find that your health insurance premium is going to go up by 10 or 15 or 20%. It's not working. We don't have a healthcare system. We have a patchwork of programs that are being dictated to us by pharmaceutical companies and private health insurance companies. We don't need them getting in the way of providing health care to every Vermonter.